Soccer uses lots of leg power, and the muscles in our body help us power up for a kick. The first step in kicking a soccer ball is to step with your left foot and swing with your right, if you're a righty kicker. As you run up to kick the ball, you take a final step, plant one foot, and load the other, pulling it backward for the strike. At this point, there is a knee flexion. The prime movers are the bicep femoris, semimembranous, and the semitendinosus. The synergists are the popliteus, gastrocnemius, gracilis, and sartorius. The quadriceps as the antagonists.
After this is the knee extension, where the prime mover is the quadriceps. There are no true synergists of a knee extension. However, the gluteus maximus and soleus could be viewed as synergists to knee extension during closed-chain mechanics. The antagonists, such as the biceps femoris, popliteus, gracilis, and sartorius, are used when this knee extension occurs. And lastly, the fixators are all the muscles of the ankle and hip.
The glutes and hamstrings, as well as the adductors, control your hips. The prime mover in a hip rotation is the gluteus minimus. The synergists are the anterior fibers of gluteus medius, tensor fasciae latae, semicondyus, semimembranous, and the anterior abductors. The antagonist of the hip rotation is the gluteus maximus, the fixator gluteus medius. The hamstrings, quads, flex, extend your knees back, and the plantar flexors flex your ankles. Your abs and lower back muscles stabilize your trunk, and your deltoids align your shoulders square to the ball.
Your kicking leg depends on the hamstring, hip adductors, and glutes to control the hip during contact, and the hamstrings to extend the knee. Your hip, knee, and ankle joints are used when kicking a soccer ball. The glutes and hamstrings control the hip when kicking the ball. The hip joint is used when standing, walking, running, and kicking. The femoral head fits into the other half of the socket, which is a concave depression in the pelvis, and the femur can rotate around on this axis. The hip has a wide range of motion in all directions. It transfers the power directly to the soccer ball.
The ankle joint is a hinge joint, so it allows movement for forwards and backwards. The ankle plantar flexion is when you pull back preparing to kick the ball, and the fixators are the medial and lateral stabilizers of the knee, quadriceps, musculature of the foot. Then, when you go back to kick the ball, and the ankle dorsiflexion has the prime mover as the tibialis anterior. The ankle is made up of the bottom of the tibia and fibula, talus, the posterior malleus, medial malleus, and the lateral malleus. Plantar flexion is a movement of the foot that flexes the foot or toes downward toward the sole. Dorsiflexion is a flexion of the foot in an upwards direction, aiming to kick the ball.
The knee joint is extended when you kick the ball, and the hamstrings allow the knee to extend. The joints consist of the tibia and femur, and it extends as the thigh muscles contract. The hip swings forward in the motion of a flexion. Your muscles transfer force to the ball, and with any luck, it goes directly where you want for a successful pass or goal.